Prodromal symptoms associated with acute coronary syndrome, acute symptom presentation. Prodrome is an early sign or symptom, or set of signs and symptoms, which often indicate the onset of disease before more diagnostically specific signs or symptoms develop. It's derived from the Greek word prodromos, meaning running before. Prodromal symptoms are specific and non-specific signs and symptoms that indicate the development of obstructive coronary artery disease, indicative of myocardial ischemia. These signs and symptoms can be experienced days, weeks, or months prior to an index cardiac event. Early recognition of myocardial ischemia has been related to reduction in morbidity and mortality related to cardiovascular disease. Data indicate that the time from symptom recognition to the decision to seek medical help is critical. Sex-related biological and cultural factors and socio-demographic differences between men and women were identified as possible reasons for delay and misinterpretation of the warning signs of heart disease. Across 28 studies, individuals have reported prodromal symptoms prior to a myocardial ischemic event. The most prevalent prodromal symptoms reported were chest pain, fatigue, and shortness of breath. Prodromal symptoms were reported more frequently in numbers by women as compared to men. Mostly, they typically included unusual fatigue, sleep disturbance, and increased anxiety. Minimal evidence exists, however, that examines the predictive value of prodromal symptoms on acute coronary syndrome acute symptom presentation. Colleagues from Norway conducted a cross-sectional study which examined 533 patients with first-time acute myocardial infarction. Investigators found that prodromal chest pain, shortness of breath, fatigue, and in addition shoulder and back pain and arm pain were the most prevalent prodromal symptoms reported prior to a cardiac index event. This present study describes the prevalence and frequency and severity of prodromal symptoms in a sample of men and women with acute coronary syndrome. We wanted to examine the relationship of prodromal symptoms on baseline acute coronary syndrome acute symptoms of pain intensity and state anxiety, and the association of the prodromal symptoms with level of comorbidity. We conducted this research in one hospital emergency department located in southern Ontario, Canada. This descriptive cross-sectional study included adult men and women who experienced prodromal symptoms and were either diagnosed with unstable angina or non-ST elevated myocardial infarction. They had changes in 2 or more leads with a positive ECG finding. They reported prodromal symptoms or chest pain for more than 20 minutes or anginal equivalent acute symptoms such as shortness of breath, nausea and vomiting, dizziness, or fatigue. A prodromal symptom screening scale was developed based on current literature and expertise from cardiovascular clinicians and was given to patients to fill out once it was pre-tested and psychometrically evaluated. This is a sub-analysis of a parent study that looked at the knowledge and attitudes of clinicians and how it impacted acute coronary syndrome patients' pain and anxiety. This cross-sectional data identified prodromal predictors of acute coronary syndrome. 121 patients were diagnosed with acute coronary syndrome, admitted to a community rural emergency department, completed the prodromal symptom screening scale, and reported baseline cardiac pain intensity and state and trait anxiety. The Prodromal Symptom Screening Scale a 9-item scale of prodromal symptoms were captured in terms of occurrence, intensity, and frequency. The numeric pain rating scale, the 0 to 10 scale, evaluated cardiac pain intensity. State and trait anxiety personality inventory was used to capture state in the moment and personality trait anxiety. All tools have acceptable reliability and validity and established psychometric properties respectively. Looking at the sample demographics, the mean age of the 121 ACS sample was 67.4 years. 40% were married or cohabitating. Equal representation of men and women. Males were 63 or 52%, with 47.9% being women. 60% of the sample were retired. 1/3 of the sample reported less than high school education. 60% of the sample were diagnosed as unstable angina, and the remainder were non-ST elevated myocardial infarction. The 4 most recurrent prodromal symptoms in this sample reported were chest pain at 70%, shortness of breath at 61%, anxiety at 58%, and unusual fatigue. There were no differences between men and women in terms of the prodromal signs and symptoms. Increased acute coronary syndrome pain intensity was significantly associated with pre-hospital prodromal symptoms of headaches, sleep disturbance, and anxiety. Men and women who had prodromal headaches, anxiety, and sleep disturbance were more likely to have 20% more pain upon admission for a myocardial infarction. Interestingly, in this sample, patients with documented hypertension were 7.5 times more likely to experience prodromal fatigue prior to their acute cardiac event. This has been not well captured in the literature. The preliminary results indicated that both men and women do experience prodromal symptoms prior to the cardiac event. Most reported prodromal symptoms included unusual fatigue, chest pain, shortness of breath, and increasing levels of anxiety weeks, months, and days prior to their heart attack. Prodromal headache, sleep disturbance, and anxiety in particular were predictive of acute coronary syndrome patients' acute symptoms of pain intensity experienced upon admission to hospital. The majority of the sample reported having at least one prodromal symptom preceding their acute coronary syndrome admission. The most recurrent prodromal symptoms reported were chest pain, shortness of breath, anxiety, and unusual fatigue. The overall prevalence of prodromal symptom was 49% in this sample, which is similar to what has been previously reported. Patients with hypertension were 7.5 times more likely to experience prodromal fatigue prior to a major cardiac event. This is new knowledge and has not been well captured in the literature. When we think of cardiovascular disease and our patients in the acute, persistent, chronic, and palliative stages, we know clinically that fatigue is an unrecognized symptom that warrants further investigation. There were no statistical significant differences found in prevalence of prodromal symptoms experienced between men and women, and this is different compared to what is in the existing literature. The present findings extend what we know of the predictive models that prodromal symptoms may have on acute coronary syndrome-related acute symptom presentation. The results further suggest that prodromal headache, sleep disturbance, and anxiety may have important implications for symptoms experienced during the acute phase of an acute coronary syndrome related event, and to target educational and development of treatment interventions. Early recognition of prodromal signs is imperative for effective targeting, screening, diagnosis, and timely treatment to identify those at risk for future cardiac-related events. Improved emergent treatment of cardiac-related prodromal symptoms would benefit all patients. Our data, however, did not differentiate between first-time acute coronary syndrome and a repeated event and warrants further investigation. There were no statistical significant differences found in the prevalence of prodromal symptoms experienced between men and women, and this is different compared to the existing literature. What is warranted are future studies with a diverse sample of men and women where we can conduct sex and gender-related analysis to tease out the differences between the prodromal symptoms between women and men. Preliminary results warrant further prospective examinations over a longer period of time to get the predictive value of prodromal symptoms on major adverse cardiac events. For more information, email me at the address provided or visit our website. Thank you very much.